And well, good afternoon to this bonus episode of our World Health Assembly 76th, World Health Assembly special podcasts. Elisha is lying down with a cold poultice over her head, and I managed to find two folks who I've been dying to get on the podcast for quite a while. They are my old friend and mentor, even though I am significantly older than her, but she is nonetheless a major mentor to me, Joanna Sickler. Joanna, welcome to A Shot in the Arm Live.
So excited to be here. Thank you.
So good. And we are also joined by Allan Pamba, Dr. Allan Pamba, who is Executive Vice President of Diagnostics, Roche Diagnostics for Africa, yes?
Indeed. Thanks very much, Ben, for having me.
It's a pleasure to have you here. And my first question to you both is, what on earth persuaded you to come to the World Health Assembly this year?
I mean, the diagnostics resolution, right? So excited to be here this year, and so excited to see so much discussion about diagnostics, which I'm so passionate about. And I think coming out of the pandemic, we had sort of our moment in the sun for diagnostics, but it sort of felt like maybe it was over. And this week makes me hope that we're going to continue to see the value and why we really need to be investing in diagnostics for public health.
Amen to that. Allan?
Pretty much the same. I'm 1.5 years old in Roche, and indeed 1.5 years old in diagnostics. I spent that 1.5 years working with our team in Africa, writing a 10-year strategy for diagnostics. And perfect for us, at this point in time in history, the World Health Assembly has a resolution on diagnostics, so perfectly timing for us. Very, very timely.
Yeah, perfect timing, in inverted commas, because the way the agenda has gone this week, glacial, almost backwards. I just checked in with my friends in the WHO, and they think that it's going to be sometime on Saturday, possibly, that the resolution is discussed. But yeah, we're all really excited about it. And
keep in mind, Ben, we were originally on Monday.
Well, that's right. That's right. Yes. And can I just say, it's completely screwed our schedule for podcasts this week. But it is interesting, isn't it, that to your point earlier, coming out of the pandemic, interest in diagnostics, interest in health, and with all of these polycrises going on, one of the main reasons for the delay in moving ahead with the agenda was, of course, Taiwan, and of course the two very different declarations or statements that came from Russia and Ukraine. The one from Ukraine, of course, was passed. But let's talk about diagnostics, because as many of my listeners and viewers know on this podcast, I've become a bit obsessed about diagnostics in the last couple of years. And, it seems to me that we don't fully understand what diagnostics do. And, there's, and I've seen it here this week, a sort of a lack of understanding of what works now, what may work in the future, and what really is science fiction. And, I've really come to appreciate their crucial role in infectious disease prevention and treatment, but also stigma and discrimination reduction. And of course, a critical role as well, building on that for future disease and future pandemic response. And what I found so interesting, Joanna, in our conversations over the last few years is this very holistic approach that you take towards diagnostics, the role of laboratory systems plus point of care and how it all sits together. Could you share that vision with us all again?
Yeah, absolutely. And before I do that, I also want to touch on one of the first things you said, which is I think it's so important that we push for innovation. And I think it's so important that we're visionary about what can be done with technology in the future. We have to separate that, though, from what's available today as we move to implementation. Both those things have to be happening if we're going to get where we want to go. And when we look where we're at today related to what the technology can do that's available, what we see is we have cost-effective, high volume molecular diagnostics for infectious disease. These have been effectively deployed around the world for HIV viral load management. The second 95, right, is to know if you're suppressed, and that is an HIV viral load test. Then coming into the pandemic, everyone learned about PCR, which is what that HIV viral load is, as we move to PCR testing for SARS-CoV-2. And we have these molecular instruments that it's the same instrument, right? So you can do an HIV viral load test. You can do a SARS-CoV-2 test on it. You can also do an HPV test to screen for cervical cancer. And there's so many other things we can do. And if we're going to reach the 81% of people in low and middle income settings who do not have access to diagnostics, volume is critical. We have to figure out how to do a very large number of tests. And so there we really think about that lab as the backbone of a strong lab system and that ability to do a lot of volume. But it doesn't end there, because those tests are not going to be able to reach everyone. So we also need to think about point of care. And where do we strategically deploy point of care testing? My belief is you should be using point of care in two circumstances. One is when that immediate result is going to make a difference for how that patient is managed in that moment. And secondly, in contexts where based on health infrastructure and geography, the reality is you just can't get the samples to that high volume laboratory. I think we've also started to see some self-testing. And again, where's the technology that, right? So we have self-tests for SARS-CoV-2. They've been very effective for HIV, but most conditions, there isn't a self-test available. And so we really need to look at the scope of what's available. We need to think about national plans to put things in the right places to really support a strong and resilient health system through a strong and resilient lab system.
Allan, what has your experience been working in, I guess, West and East and Southern Africa?
Yes, just listening to Joe and reflecting on the journey I have done with diagnostics is quite interesting. The statistics is staggering. About half of the world's population have zero access to diagnostics. Yet today we know 70% of all clinical decisions are driven by technologies in diagnostics that exist. So a huge portion of the world doesn't enjoy that. And of course, that's got huge impact on their quality of life or even longevity prospects. I come from the part of the world where that statistic is skewed in the wrong direction. It's even worse, which is Africa. As a child, I probably lived that statistic because I have very little memory of being tested for anything. As a physician, in my early years of practicing in Africa, my earliest memories are I had no faith in the little diagnostics that we had. Africa, had a big epidemic of infectious diseases for the longest time ever. And as a young physician, I treated a lot of malaria cases. Very often, they will change the type of point of care test that we had for malaria over and over. And we'd always try the new test. And then, you get a negative test 2-3 times, you don't treat the patient. The fourth time, you do the test just to check whether it is positive to conform with the fact that you're going to treat anyway. So we relied a lot on clinical diagnosis, and it's a bit of a hit and miss. This is still the reality in large parts of Africa. I do see an opportunity now when we rethink, our universal health coverage targets that have become a clarion call right across the continent, not to miss out on the piece around diagnostics, because that's the cornerstone of a true universal health coverage target.
We had a podcast this morning about universal health coverage, and it was hard getting my two very, very articulate, impressive guests to define what was in scope, and we couldn't get agreement that diagnostics or some form of diagnostics should be a part of it. So if we look at the declaration that, touch wood, will be agreed without any controversy at all on Saturday, what are you hoping to see coming out of it?
Yeah, I mean, I think on my side, my hope is to really see diagnostics cemented along with vaccines and therapeutics as a core pillar of UHC. I don't see how we're going to be able to achieve the things we need to do in public health without diagnostics. They're such a key piece of the puzzle. And I think that emphasis on them and then moving towards national strategic plans for diagnostics. So countries are thinking about that integrated big picture of how do I use the resources I have in the best possible way to provide access.
And Allan, what are you looking for in the declaration?
Very similar to Joe.
I should hope so.
Very, very similar, Ben, that we don't find silence after all the time and effort leading to such a resolution. We may very well find silence and nothing happening unless the advocacy work continues. A lot of African countries with universal health coverage goals still have a big hole around diagnostics. And if I take a step further up, the even bigger gap is the allocation of GDP budgets that go into health. Back in 2001, at the WHA Declaration, all African countries signed up to put 15% of GDP to health. Today, I could count with the fingers on one hand how many countries have achieved that. Most countries are putting 3 to 5% of GDP to health. There is no way a conversation on universal health coverage is serious when you have less than 15% of GDP allocated to health. So it starts there. And I do hope that the passing of this resolution takes us back to that conversation. I think once we begin to address that conversation, then there may be a secondary conversation on the cost effectiveness of quality diagnostics at scale in a country on the overall health budget. I think that's another conversation that needs to be had. And I'm hoping that at the end of this resolution, that's a second conversation we get into.
I mean, shoot me down if I'm being oversimplistic. But from my perspective, and talking to some of the other activists here, there's just such a huge relief that there is a declaration on the WHA agenda. And even if it gets approved at 4 a.m. on Sunday morning, the point is that we've been able to get the members of the WHO to talk about it and to sign off on something. It's also been interesting this week that actually diagnostics have a little bit been talk of the town. And the real focus, I don't know if you've noticed this, has been around self-testing. And it's something that I've been reflecting on quite a lot. Last year, I was diagnosed with COVID. I diagnosed myself with COVID, and I didn't know what to do with the test result. Who do I give it to? How is that information made available to the public health community? And so while there is I think a debate about the really strong rationale of getting technology to the people for use by the people, there is a challenge in making sure that we can have a continued sense of the epidemiology of what's going on. And I don't know if you have thought, before we get on to the actual technologies, in inverted commas, have you thought about how these can fit into broader surveillance and treatment management systems?
Yeah, I mean, I think sometimes we get sort of really confused too with, the needs of surveillance versus the needs of acute care today. And I think when we talk about point of care and self-testing, that's a place where we really see that interface really strongly. When we look at the COVID-19 pandemic, we had an early phase where all the testing was PCR. And what that meant is, because it was running through labs, is we had very good data. As it moved to rapid antigen tests and home testing, there was a lot of increased access to testing that was very, very positive. I think the downside of that, though, was the access to data went down, as you alluded to. And I think that's why it's just so important to recognize that there's not one sort of magic bullet, right? We need to look at each disease, each area, and we need fit for purpose solutions. I think another aspect too of when we think about self-testing is, I think most people are thinking about either a rapid antigen COVID test or an HIV self-test. But another really exciting area is self-sampling. And that's empowering, for example, women to be able to take a sample themselves for cervical cancer and then have that sent to the lab to be able to get their screening result. And this is an additional area that I really hope we start to focus on, because I think this is going to really open up a lot of access. And in the context, too, of linkage to care, linkage to community health workers, linkages to primary care, right? We can't just drop all of these things in an air balloon and think it's going to solve the problem. All of this needs to fit within, a programmatic structure that makes sense.
I'm really, really thrilled to hear you say that, because again, it's a very forward-looking, but really concrete, ambitious thing that we could do, which is to enable people to sample themselves. Allan, have you in your career as a physician and now as a diagnostics company representative, have you explored this? Have you seen this in action? Could you see how this sort of approach could be helpful?
Yeah, I mean, self-sampling is something which, as Joanna touched on, is quite empowering for women. And we are beginning to see that with cervical cancer screening, where pilots have run, the acceptance rates amongst target populations have been quite high. And the women have actually really lauded this. So that's a very positive direction of travel. But on the point of, the role of point of care and data, one has to think about the COVID experience and realize that COVID opened our eyes to the fact that no one's safe in the world from what's going on in another corner of the world. We're all very interconnected today. When there's an outbreak of Ebola somewhere in the corner of the world, be worried where you are, because it's probably only a matter of hours away from where you are. So from a global health security perspective, even as we scale up diagnostics, we have to have a serious reflection on data and how we get data, surveillance data, and monitor it, regardless of where in the world. Again, Joanna did a good job of articulating, if you may, the two spectra of diagnostics that you'd have. You'd have your point of care on one end, reaching as far as you'd like it to reach. And then you'd have your centralized high throughput labs that deal with the huge volumes. And with the centralized labs, it's very easy to get data, collate it, and carry out surveillance analysis and know the trouble spots. And with the point of care, as rightfully pointed out, you may lose out on data. So we still need to reflect on how we ensure global health security, even as we strike a balance between these two spectra.
Well, talk about striking a balance. Here's another thing about self-testing, and Joanna, how I feel about this. The global health field has a large degree of enthusiasm and optimism about the way technology is going, but it's not really altogether rooted in reality. And a number of people I've bumped into this week, oh, Ben, it's so great that self-testing is on the agenda. You must be so happy. Well, which self-tests are you talking about? HIV, COVID? Well, yes, but also breast cancer, and hepatitis B and C, and a range of cancers. And I said, and these tests exist? Where do they exist? Oh, they're just coming. We just need generic manufacture, and they'll be here. So, I get very frustrated about this. What advice would you give people like me in trying to respond in a very polite way while holding a glass of wine and a canapé?
Well, first, I just want to look on the bright side that people are talking about diagnostics. And I'm so excited that we're talking about diagnostics. I'm so excited that people are enthusiastic about the future. I'm so excited that people want to invest in innovation. So I think those are all good things. I think the key, though, is we have to walk and chew gum at the same time. And so what we really need to do is focus on what is quality approved, scaled, available at volume today to implement, while we continue to push for the future. In terms of what you should say to these people, I would maybe just ask them to send you a link to some of these tests, because I'd like to see it.
Yeah. Cool, let's send that to me too.
Oh, totally. And business development in Roche, yeah, I'm sure.
Oh yeah. I have a lot of colleagues who'd love to know more about them, actually.
Yeah.
And I think, but that's where too, I don't want to be flippant, because we have to dream and we have to believe that these technologies are possible. I just think that also shouldn't slow us down in terms of immediate implementation of the things that are available today that can make a difference. And it's recognizing that we can do both those things at the same time.
Yeah. Walk and chew gum. I love it. I love it. So as well as trying to shepherd through or send positive vibes to the delegates of the WHA to get the declaration signed some manageable time in the day, you also held a session here with foreign policy yesterday, and Elisha and I were noticing that it was perhaps one of the few sold out events of the week. How on earth did you manage that?
Well, I think that it speaks to the enthusiasm for diagnostics. I think we were really lucky to have a lot of great experts. I'd like to thank Peter Sands from the Global Fund for coming and being our keynote. You saw the panel; it was amazing. And I think that, again, we're just so, I think I'm saying the same thing again and again, but sort of after being sort of back in the, in the back of the line, in the back of the corner for so long, it's just so great to see this enthusiasm for diagnostics. Allan?
I would agree. I mean, I completely agree with that. We saw more people turn up than we expected. They were pulling chairs in the back, and Joanna and I were talking, saying, "Look, we've got to stand in the back because the room is full." And then eventually chairs came, and we were standing behind the chairs. Fantastic. Again, similar to Joe, music to my ears. When I look at where we need to go as a continent in Africa, and I talk a lot about Africa because that's the space I work in, and where I think the need is greatest, that level of energy I saw in the room and enthusiasm gives me hope that we will get going with a robust, effort at creating a really strong diagnostics backbone for Africa in the coming years.
Yeah, I was watching it from this room on live stream, and I walked out and went down to the ground floor, and who should I bump into but Peter Sands, who'd come over for another session. Yeah. But yeah, he was telling me how enthused and excited he was about the attention that's being placed on diagnostics. And I don't want to be a killjoy at all. I'm just really interested in how we utilize and mobilize this enthusiasm. I think there's a real, and besides everyone saying they're looking forward to getting self-tests for everything, people are saying that it's, if you don't test, you don't know what disease you're perhaps trying to diagnose. And that goes back, Allan, to your first point about, clinical diagnosis, which for the longest time with HIV was such a bugbear. And, you couldn't measure viral load, but let's have a look in people's eyes. Do they look a little bit yellow, or there's a bit jaundice going on? It is in the process of changing everything. Can we also talk a little bit, and Joanna, you mentioned this at the start, around diagnostics as platforms for a range of tests? Where are we, and where do you see that side of the field going?
Yeah, I mean, multi-disease testing, multiplex testing, it's here. This is a technology that is here and available. And not only is it here and available, but as I said in the opening, those instruments are placed all around the world. They were there in places like Africa to support HIV viral load. And during the pandemic, what we saw was an exponential expansion of the molecular diagnostics infrastructure. That infrastructure has been built. And one thing, if we're going to start somewhere, that I would say is, let's make sure it stays there. All of that capacity that was used to test for SARS-CoV-2 can now be used to screen for hepatitis, can be used to screen for HPV, can be used for TB testing. And if we do that, and if we keep that capacity in place, that means if there is a future pandemic, it's still there. And so we really need to marry this conversation between acute care and access today and pandemic preparedness for tomorrow.
And to be clear, that the platforms that we're talking about you said they are molecular diagnosis. They live with labs. They live in labs, and so it's part of the solution is here with us today. So, will you stay until Saturday, to the very last minute, to make sure that this declaration gets through? Or are you heading off?
I've been getting some messages from a really sad 5-year-old that misses his mom. And so unfortunately, I am not going to be able to stay. Fortunately, we have many members of the team that are based here in Switzerland. And so we're just keeping our fingers crossed that we will get over that finish line.
Yeah. How about you, Allan?
Yeah, I'm getting the same messages. But over and above that, what they told me, Ben, when I arrived? We've been having terrible weather here. It's been really cold, but then this week it's been very sunny. It started getting cold again. So I'm leaving tomorrow.
Getting out of here. Yeah.
He can't handle it.
No,
Kenyan.
I'm leaving with my son.
Yeah. So brilliant. Are there any things that we've missed? Things that, Ben, you really need to say this, or we need to talk about?
I don't know, Allan.
No, I think you covered all the key topics, Ben, that I had in mind. I love the fact that we touched on universal health coverage and the conversations that need to follow from this. And you did ask the question, how do we keep the momentum? How do we keep this going? And I think part of what we're doing right here in this podcast is how we do it. Spread the word, activate people. This is now a resolution that hopefully will have been passed. And people have an opportunity to ask their difficult questions and get the answers that they deserve.
And I think one thing that's really crystallized for me this week, being in sessions, meeting with people, is we got one shot at this. So this is the moment, and we all have to suck it up and work together. And that means us partnering with, our competitors and industry. I have finally been convinced that no, I can't just focus on IVD diagnostics, and I have to learn more about imaging. I know nothing about imaging, but Ken Fleming from the Lancet Commission has made it clear to me it's very important, and we better start focusing on it. And I think that goes for all the stakeholders, right? We can't let politics get in the way, and we really have to recognize that. We all have to work together to implement this, assuming it goes through this weekend.
But you are one of those incredible Renaissance women who have lived in the non-profit sector, in the startup sector, and now in a multinational sector. So you bring a lot of expertise to bear on that, and I think we're going to hold you to it. The other thing, just before we go, Roche, and I'm struggling here to remember what the name of the company is, or your division. Roche Molecular?
Roche Diagnostics.
Roche Diagnostics. It's not the work that you've been doing over the last decade or so is not as well known as it should be. You've had partnerships, for example, with the Clinton Health Access Initiative and with Product Red. And I promised a diplomat who will remain nameless that I would ask you about this. Are your diagnostic tests that you make available to Product Red, are they red?
No, that is not compliant. And so, in fact, I will, it's very strong clarification here. Our partnership with Product Red has nothing to do with product, because that's actually not appropriate, because our diagnostic tests are actually procured by the Global Fund. Our partnership with Project Red is solely based around communication, education, and they've been an amazing partner for us to help us nerds in diagnostics explain why they're important. They do amazing work, and we've been so excited to partner with them.
Well, great. Well, Joanna, Allan, thank you so much for making your way over to UNAIDS and not getting arrested coming in. It's been really wonderful to have you on the podcast, and wish you every success and keeping everything crossed for Saturday.
Thank you, Ben.
Thank you.
Fantastic.
Thanks so much.
Well, that's it for this episode. And indeed, that is the last of our World Health Assembly podcasts. Hope you've enjoyed them. You'll be able to find them on all your podcast platforms, as well as YouTube, LinkedIn, even Twitter. If you're still in Geneva, stay safe. And if you're in the real world doing real work, go for it. Okay, then. Cheers now.